In this lesson, we'll begin our discussion of the reproductive system. Let's focus on the male reproductive system first. So the beginning of the male reproductive system, we'll start with the scrotum. This is a fleshy pouch. This is suspended from the perineum. The perineum is just another name for the pelvic floor, which is made up of muscle. It's just anterior to the anus and posterior to the base of the penis. So if we take a look over here, this would be the scrotum. And again, we can see it's behind the penis. And then this would be the anus here, the rectum and the anus. Right, so it's just there. And then here's our perineum, the pelvic floor. Now, the testes are suspended in the scrotum. While a baby boy is developing, the testes aren't in the scrotum right away. They actually descend into the scrotum about the 7th month of fetal life. There's a canal known as the inguinal canal. I'll show you that in a couple slides. Once we're in the scrotum, we're looking in the scrotum, it's actually divided into two chambers, or what we call scrotal cavities. We can't have the two testicles in one cavity because it's very possible that they could get twisted together and strangulate each other, and that would be bad. So they have to have their own compartment. And again, we call that a scrotal cavity. Um, there's a connective tissue wall. Let me show you real quick here on anterior view. So you can see right here, this is the connective tissue wall. It's like a septum. The word septum means wall. And then out here, you can actually see it on the skin. There's like it looks like a seam to me. It's like a little raised area. That is known as the raphe, and the raphe shows where the septum is, right? So if you looked on the outside here, there'd be like a seam right over here. It's kind of what it looks like to me. So the raphe is the raised thickening that we see in the scrotal surface, and it just tells us where the two scrotal chambers are located. Now, there's a couple muscles that are important to maintaining the temperature of the testes, which help with the survival of the sperm. And the first one is actually found in the skin of the scrotum. It's called the dartos muscle. Now, it's a layer of smooth muscle in the dermis of the scrotum, and it causes the characteristic wrinkling of the scrotal surface. So say a man was in a kind of a colder environment, the dartos muscle would contract, the testes then would get kind of pulled closer together and even maybe a little bit closer to the body of the male. And again, the testes would appear kind of like a wrinkled, in a kind of wrinkled, I guess, better, like a better words. If the male were going to like a warmer environment, the dartos muscle would relax, and then the skin of the scrotum would look more smooth in appearance. So depending on the temperature, that will change. The Let's show you where that one is right here. So I have a picture. This is actually a cross section through the scrotum and the testes. So out here, this would be like the layer of the skin, the epidermis and the dermis. See these little pink lines right here? Those would represent the dartos muscle. And so that's smooth muscle right in the skin. Now, a little bit deeper is a muscle known as the cremaster muscle, right? Um, this actually will pull, actually physically will pull the testes closer to the male body up to the perineum. And again, the male body is, 98.6, so this will help to, warm the testes if the man is in a colder environment. If the male is in a warmer environment, then the testes will descend, the cremaster muscle will regulate. So the concept is both of these muscles help to regulate the temperature, right? Normal sperm is going to develop in the testes, and it requires temperatures about 1.1 degrees Celsius or about 2 degrees Fahrenheit lower than the male body temperature. Again, it just kind of relates to the survival of the sperm and the ability to make sperm. It has to be a little bit cooler than body temperature. So as I said before, when these muscles relax, the testes are going to move away from the body. And when the muscles contract, they're going to move towards the body just to keep a nice homeostasis as far as testicular temperature. Let's show you the cremaster muscle. I like this picture here. Let's go to this. So one more time, we have this the skin of the scrotum, right, like the epidermis and the dermis, and then you can see the yellow, excuse me, the pink bands in there. Those are the dartos muscle. Then we have a little bit of a subcutaneous tissue right over here. Now look at this muscle here, going all the way around. This is your cremaster muscle right here. Okay, let's make sure we got everything. Good. The testes, so we said they are suspended in the scrotum. They're egg-shaped, just a little bit of Trivial Pursuit stuff. They're about 5 centimeters long, 3 centimeters wide, and about 2.5 centimeters in thickness. And they weigh, like a half an ounce. And the main thing is they are suspended in the scrotum. Now, functionally, the testes are responsible for making male sex hormones. If you remember when we studied the endocrine system, testosterone was one of the main androgens, and that was produced by the interstitial cells. Sometimes they call them the interstitial cells of Leydig. Those were between the seminiferous tubules that we had looked at. But the other function of the testicle or the testes is to produce sperm, right? So the male gamete is known as a spermatozoa. Not many people say that in, kind of daily life. We typically more will refer to sperm. Same thing. If we were to do some dissection and take a look at the testes, we would see there's a white like capsule around the testicle known as the tunica albuginea. This is a dense layer of CT, connective tissue, that's rich in collagen fibers. What's important about it, these collagen fibers actually extend into the testicle, forming these little partitions or walls known as septa. So let me show you a picture of that. Again, back to this picture here. So this is the testicle right here. Again, it's on cross section. They did a transverse section here through the testes. So this is on cross section. So the tunica albuginea would be this white layer right here where my cursor is going. All of this right around the whole testicle. But then look at this. It projects collagen into the testicle, forming these compartments, which I'll talk about in a minute. But these are known as the septa, right? That would be the wall. I have it labeled for you over here, right? But it would be the same thing on this side here. Those are known as the septa. Okay, so again, they are arising or derived from the tunica albuginea. So the little compartments that the septa form, we're going to call lobules. Now, what's important is that the lobule contains about 800 slender and tightly coiled tubes. These are known as the seminiferous tubules. Their job is to produce the sperm. This is really interesting. Each tube is about 32 inches long, right? 80 centimeters, which is about 32 inches long. So if we tied them all together, we'd have about a half a mile of tightly coiled seminiferous tubules, right? That's pretty impressive. You're fitting, a half a mile of tubules in the testicle. So these seminiferous tubules are going to form a loop that's going to connect to something known as the ready testes. The ready testes is a network of passageways. So let's take a look at what that means. All of these seminiferous tubules, right, they're in the lobule. So each compartment we're going to call a lobule. The coiled tubes here are the seminiferous tubules. But now if you notice, those tubes are all going to lead to this structure here called the ready testes. These lobules have little tubes right here called the straight tubules. Here's one here, here's one here. They're not showing it here, but the straight tubule, excuse me, is how the sperm is going to get to the ready testes. And then while I'm here, we'll see that the ready testes is going to lead to this structure up here. This is the head of the epididymis. I'm going to talk about that in a few slides. These little tubes right here that bring the sperm from the testicle into the epididymis, these are called the efferent ductules. Efferent. Okay, so it goes seminiferous tubules to the straight tubules, to the ready testes, to the efferent ductule, to the epididymis. Let's go back a moment. Okay, so that was that right here. So this is what the ready testes is. And as I mentioned, just from the picture, from the ready testes, the sperm is now going to move into these kind of large efferent ductules. There's about 15 to 20 of them. And they're known as the efferent ductules. Think of E for exit, right? They're going to be exiting the testicle and going into now another structure called the epididymis. Right, that top part is actually known as the head of the epididymis. Again, I'm going to show you that in a couple minutes. We're only seeing part of the epididymis. Right, so this is an important slide. You want to know again, the tunica albuginea, the septa projecting inwards, forming a lobule. What's in the lobule? The seminiferous tubules. They produce the sperm. The sperm is then going to leave through the straight tubule, enter into the reti testes, right, the ready testes, and then exit the testicle through the efferent ductules, and now they're going to go into the epididymis. And here's a cross section of the seminiferous tubules, and we actually looked at this when we did the endocrine system. We didn't really study this per se. We actually studied the cells in between the seminiferous tubules. Remember, those cells were the ones that produce here they have it labeled down here, the testosterone. These were the interstitial cells. And so this should look a little bit familiar. So this slide is going to talk about those interstitial cells. Between the seminiferous tubules, we do have areolar connective tissue kind of filling the space between the tubules, and those spaces contain blood vessels. But again, this goes back to the endocrine system. The interstitial cells are located between the seminiferous tubules. They used to call them interstitial cells of Leydig or Leydig cells, and they are the ones that are, again, going to produce the testosterone. Okay, so from the testes, the sperm is now going to go into the epididymis, and we can consider this the start of the male reproductive tract. This is the course that the sperm is gonna follow. This is a coil tube. Look at this, 7 meters in length, about 23 feet. So that's all going to be packed inside the epididymis. Let's divide the epididymis into three parts. So that top part that's receiving the sperm through those efferent ductules, that's going to be known as the head of the epididymis. Right? So if we take a look here, this is a different perspective. So again, testicle, here's your lobules. Right? They contain the seminiferous tubules. Here's your straight tubules here to the ready testes. And then here's your efferents, right, efferent ductules. Now, right here, this is the head. So that's at the top of the testicle. Then while I'm here, let's take a look. This would be the body of the epididymis. And then at the bottom of the testicle is the tail of the epididymis, right? So again, at the top of the testicle is the head of the epididymis. Running along the posterior aspect here is the body. And then at the bottom, the body is going to become the tail. And then look at this, the tail is going to lead to the tube that's going to bring the sperm into the pelvis of the male. This is known as the vas deferens, or you can see here called the ductus deferens. We have a bunch of different names for it. Vas deferens, ductus deferens. There's a couple, like I said, a few other names also. So what's important on this slide is the head, the body, and the tail of the epididymis. All right, so again, the head is at the top, as we said, and that's going to receive the sperm. The body's going to run along the posterior margin of the testes, and then the tail is going to be at the inferior border of the testes. We actually see that the number of coils is going to decrease, and then that tail is going to turn into the ductus deferens. Again, if you just want to jot down, the ductus deferens is just the same thing as the vas deferens. And this is where sperm is going to be stored until it's going to be released. And it's a great picture. Okay, so let's take a look at the region where the vas deferens is going to leave the scrotal area and go into the male pelvis. And there's some structures going down into this area, like arteries and veins and nerves. So this is going to be called the spermatic cord, right? This extends between the abdominal pelvic cavity and the testes. So before I even tell you what's in there, let's take a look. So if you kind of take a look here, you see both testicles. Remember we said this was the scrotal septum here. This was the raft down over here. So one testes is in the right chamber, the scrotal chamber, and then the left testes is in the other one. On this side, they have the cremaster muscle in place. On this one, they took the cremaster muscle off so that we could see some of the deeper structures. So where my cursor is now, the testicle. Here's the epididymis on top, right? So this would be like the head right here, and then we could see the body kind of going down the backside, but we don't see the tail. Now, this whole tube right here is known as the spermatic cord, and there's some important structures inside the spermatic cord. Let's take a look. So there's blood vessels, right? There's a blood vessel called the deferential artery, right? We probably didn't talk about that ever, but we did talk about the testicular artery when we did blood vessels. This was the one of the branches that came off of the aorta, and it goes down and it brings blood to the testicle. And we also talked about the testicular vein. However, I want to show you something about the testicular vein. This vein forms a network of veins. Here's your testicular vein coming down this way, and it comes down, but watch what it does. It starts to branch and form a network like this. This is called the pampiniform plexus of the testicular vein. One of the reasons this does this, by doing this, the vein actually takes some of the heat, some of the warmth out of the testicular artery. If you notice the testicular artery here is going kind of through this pampiniform plexus, and the pampiniform plexus, these network of blood vessels, actually draws heat out of the testicular artery so that the blood getting into the testicle is a little bit cooler. Remember, we said that the temperature of the testicle needs to be 2 degrees less than the male body temperature. So it's kind of an important um, structure to our survival, right? Again, if this arterial blood was warm, right, it's possible that the sperm wouldn't form correctly. So on an exam, I do want you to say the pampiniform plexus, if I were to ask. We have some nerves that are in the going down to the testes. The genitofemoral nerve is one of the nerves off of the lumbar plexus. So the spermatic cord is actually in the inguinal canal. So I had mentioned this earlier that the inguinal canal is the passageway that the testes descend from the abdomen into the scrotum, again, about the 7th month of life. Okay, so just one more time, make sure everybody's good on this. What we see inside the spermatic cord, the white tube, the vas deferens or the ductus deferens. The red blood vessel here is going to be our testicular artery. And again, that's surrounded by the testicular vein, but specifically the pampiniform plexus. Okay, let's take a look now at the ductus deferens or the vas deferens. This is the tube now that's going to bring the sperm into the pelvis of the male. This is about 16 to 18 inches long. Before I go through the notes here, let's just take a look and you can see the course that the vas deferens takes. So starting here, epididymis, head, body, tail. Now, this is the vas deferens. Notice it goes up through the spermatic cord, goes anterior to the pubic bone in the male. Here's the pubic bone, enters the abdomen, and it goes over the bladder, around the back of the bladder, and then in the back of the bladder, you can see it expands a little bit. This expansion is known as the ampulla. Right, so that's a long way that the sperm has to travel, all the way this way again, right in front of the pubic bone, goes over the pubic bone into the pelvis, male pelvis, over the bladder, behind the bladder, and all the way back here until it expands as the ampulla. So like I said, it's about 16 to 18 inches long. And again, it begins at the tail of the epididymis. And as part of the spermatic cord, it's going to ascend, right? It's going up through the inguinal canal. And then it curves inferiorly along the urinary bladder towards the prostate gland and the seminal gland. I'll talk about those in a few other slides. And the end of the vas deferens then expands, and we call that the ampulla. So we said that this is a long way that the sperm has to go. How does it move through that tube? Well, during ejaculation, there's very powerful muscle contractions of the smooth muscle in the vas deferens. So what we see, there's actually a very thick muscular wall. This would be the lumen, right? This is where the sperm is going to travel. And then you take, and these is just epithelial cells over here. But look at the smooth muscle. It's very, very thick compared to, say, like a blood vessel, that type of thing, or even a layer of smooth muscle in an organ. The reason this is so thick, it has to propel the sperm all that way. And very powerful muscular contractions. Yeah, that's why I have here just a thick layer of smooth muscle. Okay, so that's the course that the vas deferens runs. Now, the vas deferens is going to meet with another duct known as the ejaculatory duct. Right, this is a short passageway. This is less than an inch. This is at the junction of the ampulla and a duct coming from a gland that we're going to talk about in a moment, known as the seminal gland or the seminal vesicle. So basically, this ejaculatory duct is going to be bringing the secretions of the seminal vesicle to meet with with the secretions of the ampulla, which is the sperm. So if you take a look here, this structure here is the seminal gland or the seminal vesicle. Right here, it's intact. Here, they cut into it, but the, the, the secretions of the seminal vesicle will come down this way into this little duct right here, and then that's going to become the ejaculatory duct right here. And notice this is where the sperm is going to come. So now the sperm here and the seminal fluid here is going to mix in the ejaculatory duct. So we're beginning to make semen. And then we're going to see in a moment this kind of walnut looking gland right here. This is the prostate gland. The prostate gland is going to release its fluids, right, so secretions, to complete the semen. And so semen is actually three things: sperm that's coming from the vas deferens. And here's the ampulla. Seminal fluid or seminal fluid coming from the seminal gland, and then prostate fluid all mixing in the ejaculatory duct. And then we'll see that it's going to leave the male body through the urethra. Right, so everything's kind of uniting in this area. Again, this is right behind the bladder. This is a posterior view of the bladder region. Okay, so again, the ejaculatory duct, short passageway, again, it's a little bit less than an inch. It's right at the junction of the ampulla and the seminal gland duct, right? So that's the duct we're coming from, the seminal gland. And then this ejaculatory duct is going to enter the prostate gland, and then eventually it's going to lead to the urethra. Finally, this is the last part of this passageway of sperm. The sperm is going to leave the male through the urethra, right? We'll actually studied, or we did study already, the urethra in the urinary system. So this is a tube that's actually shared by the urinary system and the reproductive system, and it's about 7 to 8 inches in length. It extends from the urinary bladder to the tip of the penis, which is known as the glans. And if you remember from the urinary system, that we divide the urethra into three parts. Let's see if I have let's go back this way for a moment here, just to remind you. So from the urinary bladder, in the prostate gland, this urethra here is the prostatic urethra. In the pelvic floor right here, this little urethra right there, that little piece, is the membranous urethra. And then the rest of the urethra that's within the penis, you could say either the penile urethra or the spongy urethra. Right here, they have it labeled as spongy. The reason for that is this is erectile tissue right here, known as the corpus spongiosum, and the urethra runs right through that corpus spongiosum, right like that. All right, so your choice. You could say either the penile urethra or the spongy urethra. They're both correct. Okay, so I didn't add any notes here because we already had talked about that when we did the urinary system. And just on this picture here, this would be the prostatic urethra right here. And then this is the pelvic floor. So this would be the membranous urethra right here. And then going distally, then right out to the tip of the penis, this would be the penile or spongy urethra. Again, your choice. Okay, so that's pretty much the track that the sperm follows. I want to talk about three glands that are important to the male reproductive system. We call these accessory glands, and they're going to help to produce the semen. I've mentioned two of them already, which produce the semen. The third one is not so much as far as producing semen, but it's helping to prepare for sexual intercourse. So the three glands are the seminal glands. Again, I sometimes say the seminal vesicles. It's the same thing. The prostate gland, and then a gland called the bulbourethral gland. This is also known as the Cowper's glands. So let's take a look at each one of them. So the seminal gland, again, or the seminal vesicles, they're about 6 inches in length. These are extremely active secretory glands. They actually produce the majority of the semen. They're producing about 60% of the semen. So that would be these here, right here on the left side. This is a posterior view, so we're looking at the back of the bladder. So this would be the left seminal gland here, and here is the right. Excuse me. Here is the right. Right, this one they just cut into. Then this is going to be the second one is the prostate gland. This is a small muscular organ that encircles the proximal portion of the urethra. Again, that would be the prostatic urethra. This produces about 20 to 30% of the semen, and you can see it right over here. Again, it kind of looks like a walnut. And finally, before I go back to the notes right here, in the floor of the pelvis, there's a gland, small glands known as the bulbourethral glands, or sometimes they call them Cowper's glands, right? They're right in the floor of the pelvis. These now, they're a little bit more active prior to sexual intercourse. Just a male having sexual thoughts, or in the beginning of sexual intercourse, these glands will produce an alkaline, kind of a thicker secretion that helps to go down into the urethra and neutralize the pH of the urethra. If you remember from the urinary system, the average pH of urine is about 6, which is slightly acidic. So sperm don't do well in an acidic environment. So this secretion will help to neutralize the, let me go back to this picture over here, it will help to neutralize the environment of the urethra. So here's the bulbourethral gland here. And again, you can see it's not near the ejaculatory duct or the prostatic urethra. It's a little bit lower, right? A little bit more distal. And then it's going to put the secretion, and then the secretion goes all in here. It's kind of a clear, thicker type of secretion, and it neutralizes all of the urethra. Then what it does, it actually leaves the tip of the penis, which is called the glans penis, and it will help to lubricate the tip of the penis for sexual intercourse. Right? Females have a similar gland that we'll talk about when we do the female reproductive system, known as the Bartholin's glands. So they have the same structures and for the same purpose. So that's known, again, you could say either the bulbourethral gland or the Cowper's glands, right? So these are more rounded shaped glands located at the base of the penis, right in the pelvic floor, and they secrete again a more thick alkaline mucus, which helps to neutralize, the pH of the urethra, which could be around a 6, and then helps to lubricate the glands. Now, the glands penis is the name we use for the tip of the penis. Okay, so again, one more time, as far as the production of semen, the sperm will come down through the vas deferens here. The seminal gland will secrete its secretions, right? They go into the ejaculatory duct, and now the prostate will contribute its secretions, and then hopefully everything has been already kind of lubricated and neutralized by our Cowper's glands, or what we can call the bulbourethral glands. Okay, so those are the glands associated with the male reproductive system. Let's take a look now at the last part of the male reproductive system, the penis. You could think of this as a tubular organ through which the distal portion of the urethra passes, as we just saw. We can divide the penis into three distinct regions. The root is the fixed portion that attaches to the penis right to the body wall. So if we were to look, let's go here for a second. Right, this part here of the penis is in the male pelvis, right? You can actually see it goes down to the, to the ischial ramus right over here. This is part of your ischium, right? Here's your pubic bone right over here. So it does extend well into the body. Um, the second part we're going to call the body, right? Or some people call it the shaft. This is the tubular, movable portion of the penis. What's interesting about this, or what's important about this, there are three columns within the body that are erectile tissue, which are necessary for sexual intercourse. And then the tip of the penis, right, the very end, distal portion, is known as the glans. Notice how it's spelled, right? Not Gland as like a gland, right? There's no D, it's glans. This is the expanded distal end of the penis. Now, in a baby boy, when the baby boy is born, that glans penis is covered by what we would commonly call the foreskin. This is known as the prepuce. Now, this is a fold of skin surrounding the tip of the penis, and it goes from the neck and continues over the glands. So just to show you, let's go to this picture here. This expanded portion of the penis is the glands, and then there's a little bit of a constriction right here, and then it goes to the body. That constricted area here is known as the neck. So the prepuce, right, the foreskin would start here and then extend over the glans penis. Now, if a male stays uncircumcised, throughout his life, that would be the prepuce that would be visible. For a male that did have a circumcision, that is the portion, the prepuce, that is removed during the circumcision procedure. Okay, so this is just kind of a frontal view through the penis. You can see kind of the body right over here, right, leading to this would be the neck area here, and then the glans penis would be right over here. We'll talk about the erectile tissue now, but this is just a cross section of the penis showing the erectile tissue. So let's take a look at the erectile tissue. Again, like I said, they're located in the body of the penis. There's two cylindrical masses of erectile tissue known as the corpus cavernosa. Um, these are under the anterior surface of a flaccid penis, and they extend all the way up to the neck of the penis. And each erectile cylinder is going to surround the central artery. So if we kind of go back over here, this is, like I said, a cross section of the penis. This would be one of the cylinders of the corpus cavernosa. Here would be the other one, and then you can see the artery in the middle. The arteries are going to bring the blood, and then the blood is going to fill the erectile tissue for an erection, again, which is necessary for sexual intercourse. The other erectile tissue is the corpus spongiosum. This is a little bit more slender. There's only one of them, and they're going to go from again, the urogenital diaphragm is just the pelvic floor, if you want to mark that down. Um, it's going to extend from the pelvic floor to the glans penis, and it actually forms the glans penis. So let's take a look. Here's the corpus spongiosum. Here's the penile or the spongy urethra right over here. But if you take a look, right, here's the corpus cavernosa right here. Right, those are the two cylinders, and they go right to the neck over here. But if you take a look, the corpus spongiosum travels all along, right from the pelvic floor, all along here, all along, and then it forms the glans penis. So the glans penis, in essence, is erectile tissue. Right? It's the tissue that makes up the corpus spongiosum. Okay, so again, two cylinders of corpora cavernosum and the corpus spongiosum. All three of those make up the erectile tissue. Okay, and that is the male reproductive system. Just a couple more slides, just a little bit about the sperm cell. So we said earlier in this lesson that the sperm is formed and it actually matures in the seminiferous tubules. If we were to cut into the seminiferous tubules, we would see these cells called spermatogonia. They are stem cells, and their job is to just continually divide and make other cells that become the sperm. And males, they can produce sperm their entire life. So this is a cross section of the seminiferous tubules. If you look out here, all along the outer edge, these are the spermatogonia. And like I said, these are like stem cells. And then they divide, I'm making this a little bit simpler than it is, but they divide into, primary and secondary spermatocytes. And then these spermatocytes, they're going to divide into what they become spermatids. And then the spermatids eventually are going to become the sperm. So there's a whole progression of development of making the sperm. While I'm here, uh, there are cells known as nurse cells. There's a couple of different names for them, Sertoli cells, sustentacular cells. There's a few names for them. But these nurse cells help to um, kind of regulate the process of producing the sperm. So we see these cells in here. These are the nurse cells. All right, so again, spermatogonium. These are the stem cells. They divide and they become these spermatocytes. There's primary spermatocytes and secondary spermatocytes. They become spermatids, and then eventually the spermatids will become the sperm or the spermatozoa. Right, so here's those Sertoli cells I was talking about. It's kind of like an outdated name. The newer term, really, I hear more nowadays, is called the nurse cell. Right, they're going to support uh, the this whole process of producing the sperm. Finally, let's take a look at the actual. Oh, by the way, let me show you real quick before I show you the sperm. So this is again a diagram of the seminiferous tubule. Right, so here's a real seminiferous tubule. So again, out here along the outer edge would be the spermatogonia. Right? And then they're going to divide into the spermatocytes, which would be kind of like in this general area here. All right? And then they're going to become spermatids closer to the lumen here. And then the spermatids are going to become the actual sperm cells. So the sperm cells will be kind of all hanging out like right in here. And then once they're developed, they'll go into the lumen and they'll just go through the whole passageway of tubes that we talked about a little bit earlier in this lesson. And it's just another picture. Again, just you can see multiple seminiferous tubules here. Again, remember in between is where we would have the Leydig cells, right? The interstitial cells that produce the testosterone. Okay, so the last thing I want to show you is the actual anatomy of the sperm cell. Let me go back a moment, just so that we're following our notes. Right, so the sperm cell is going to have the head, and on the head, there's a little structure known as the acrosome. This is important for releasing different chemicals for fertilization. Right next to the head is the neck. Then there's an area called the middle piece. And then finally, there's a tail, also known as a flagellum. Right, so you could take over here, take a look, right, the head, right, this little piece on here is the acrosome. This is going to be I'm sorry, the neck right here. Right, then there's a middle piece, and then this whole thing here is the tail or the flagellum. And this is going to kind of whip so that it propels the sperm. And last slide here. This is an actual just picture of some sperm. You can see you have to magnify pretty high power, almost 1,000 times to see again the different anatomy of the sperm right here. You can definitely see the head, the neck, the middle piece, and then our flagella. And that concludes our anatomy of the male reproductive system.